Hello, I'm Edie Baldwin. The article I reviewed is titled Orthographic Support for Word Learning in Clinical Populations, a systematic review that was written by Grace Clark and Christina Ruderskold. The purpose of the research was to explore if there's any evidence in clinical students to support having a vocabulary word present in written form alongside of a picture representation or simply a verbal presentation during a learning task. How they define clinical students are students who have been diagnosed with things such as a language development disorder, an LDL, an autism disorder, which is AD, dyslexia, or any other language impairments that could occur. Someone with hearing loss and may have a cochlear, any of that type of a student. Questions that were asked is, what clinical populations benefit from the presence of orthographic representations during word learning when compared to orthographic absent conditions? The other question they asked is, how can clinicians use the presence of orthography during vocabulary instruction? The methodology of this mixed methods study was used to search through 5 major databases and looking for other research. But they had criteria that they set forth. Some of the various criteria included keywords, and they looked for language development disorder, dyslexia, intellectual disability, word learning, semantics, orthography, and cochlear implants were some of them. The studies they found were sorted to find participants who met this criteria, and then this would be their the participants that they used they have to be under the age of 18, must be in one of those clinical categories that I mentioned. They had outcomes that included word learning. They had to be experimental or quasi-experimental designs, and they were peer-reviewed, and orthography had to be a manipulated condition. What they mean by orthography being a manipulated condition is this. They had to try groups of students who used the orthographic representation and then students who the orthographic representation was absent, and they wanted to control those two variables and see the difference in the outcomes. As the studies were eliminated, there is a tool they used which was a 16-item questionnaire, and this way they could assess the data qualitatively and quantitatively. All the studies could be assessed the same way. They were given a score to narrow down the studies, and they went from 1,100 studies to 5. So they had found over 1,000 studies that included some of those criteria, and they limited it to just 5 studies. The results showed that in the clinical populations, all benefited from orthographic representations compared to the orthographic absent situations. What they did learn is that not every single Down syndrome child benefited from the orthographic representations, but those inside of the window of Down syndrome there were benefits to many of them. So they did find that within each of the learning disabilities, there was benefits to the students, several of the students who had the representation, although they could not say that it was 100% success for the representation versus the absence of the representation. They had to identify correct spelling of the words, and they were often able to identify the correct spelling when the orthographic representation had been present, which I will refer to here in just a little bit, and what that means. One group observed the eye movement of participants while they looked at the card that was written with the orthographic word compared to the word card that had previously shown the orthographic representation, but now the word was absent. What they found is the students who had looked at the card with and now were looking at the card without, their eyes actually stayed longer on the card without the representation, so without the word. And what they are finding then, and this is where I'm coming back to what I had mentioned, is, and this is a part of the discussion, there is evidence that there is a mental, I want to say it right, mental graphemic representation that is being formed when the student sees the card, and this can lead to a stronger semantic, orthographic, and phonological representation. That connection right there is a piece that will serve in the success of their spelling. So the discussion is where it comes into my classroom and it starts getting fun. If that works for the students, and this is where the clinicians can use this, that was one of their questions, is how can they use the presence of orthography for vocabulary instruction? If the clinicians can use this for their students who have some disability in some way, take it into a general ed classroom, and how can we, when we identify students who are struggling with their spelling, how can we use that to help aid them? They're not going to necessarily receive the services, but now we can use some of that to help boost them in their skills. The focus was some of the limitations that they asked, and where could the research go from here, is that they didn't try all learning disabilities. They had some that they left out. They wanted to try some more of those, as well as typically developing students. So the students who don't show any learning disabilities, and that's where it could walk into my classroom and could be something that I could actually pursue as well. So the implications of this are starting to become very interesting.